You're still hurting, even after trying everything your doctor recommended. Rest, physical therapy, injections, and maybe it helped for a while, but the pain always comes back, and no one can really explain why. It's frustrating, it's discouraging, and it's starting to feel like the new status quo. And here's what most people and most doctors miss. Pain isn't just about the joint, it's about the whole system. And that's exactly the approach my guest today, Dr. Sassy Weinstein, takes. She's one of the few physicians who's board certified in both sports medicine and lifestyle medicine, and she treats pain by treating the entire person. In this episode, you'll discover why your pain isn't improving and what's actually keeping you stuck. So if you're tired of short-term fixes and want to feel strong again, this episode is for you. So let's do the show.
Can we start with what kind of good care means to you when someone walks into your clinic?
Yeah, absolutely. So I am a sports medicine and lifestyle medicine physician. I'm trained in family medicine, went on to do sports medicine fellowship, and then followed that up, a few years after with a lifestyle medicine board certification. But I feel like the way that I've always practiced medicine has been from a very kind of whole-centered point of view, right? And for me, sports medicine is not just about like your knee, right? So when you walk in and you're like, listen, I've been having this ongoing knee pain for, 10 years, kind of comes and goes, worsens if I do too much or if I, go on a long trip and I'm walking a lot. So, kind of these more chronic injuries. I also see a lot of the acute injuries, but I'm not just honing in on like your knee, right? I first will kind of get the whole history. I'll do the exam. I'll see really what's going on like with the knee itself, obviously. But then I bring in all these other components, like asking about, what does their actual movement patterns look like? What does their diet look like, right? What are their stress levels? And, how do they cope with that? Because all of that plays a role in our joint health, and kind of trying to tell patients that it's not just your joint, right? Your joint's a whole environment, but there's so many other things that contribute to that environment that are outside of the knee, right? And so if you're eating a diet that is high in ultra-processed foods, your body is in this state of chronic inflammation and chronic stress, and obviously that's going to affect your joints as well, and your whole body. Or if you're sleeping 4 hours a night, that's also going to put us into this, high stress level and affect our joints too. And so kind of getting this whole picture from the patient and seeing what does their day-to-day look like, what's going on in their life, helps me to really figure out how to treat them best, whether that's going to be through, more of a focus on nutrition. Obviously, we'll treat the pain. I love injections. I love procedures. I love doing all that stuff to kind of get them out of that immediate pain, obviously, to help them get back to doing the things they love doing. But then also diving deeper to prevent this issue from coming back and making this more of like long-term sustainable change for a healthier lifestyle.
So I love that. So from right at the get-go, I'm hearing you say that all these other pillars of lifestyle directly affect their pain, their level of pain and the level of inflammation, which affects their pain. I'm also wondering or thinking like it affects all these pillars of lifestyle we know affect mental health and how related
100%.
our perception of pain is to mental health. Yeah,
100%.
you must see that.
Yeah, and it's so interesting actually, and I think it even, I don't like know the studies of this, but I'm sure they're out there. But even just from like anecdotal evidence, kind of seeing my own patients in terms of pain tolerance, again, pain perception, right? I really see the variety between patients of like how much pain they're actually in, what they're presenting with, what's actually going on, like clinical picture. And yes, and I think once we talk about that social connection piece and what's missing, right? I think that is, and I'm so happy that kind of post-COVID, all of this is now kind of coming up, the importance of social connection for overall health and wellness. And I think that is such an important factor, again, affecting our mental health, which then again affects the rest of our body and how we go about our day-to-day life.
Yeah. And the pillars are all related in that sense. You can't almost like talk about one without considering the other. And so when you say root cause in sports medicine, I'm hearing that includes those pillars. It must also include, I heard you say, like their movement patterns. So how they're loading their joints on a regular basis. And
Yes. Or
talk more,
if they are.
or if they are, sure. Yeah. Talk more about that, because like, I think one thing I've come to learn in my sort of journey in understanding pain and is how connected the body is, like how foot pain could actually be the cause of it, could be some imbalance that you have in your upper body that's actually leading to imbalance in your hip, that's leading to imbalance in your knee or your foot. Is that, I mean,
Yes.
is that how do you assess someone, like when they're having pain and when they're, like, let's say I came in the clinic, this used to happen to me all the time. I would get plantar fasciitis, just would come like for no reason. Suddenly, like I was not even when I wasn't even that active, like, and then it would just disable me and I would do all this stretching and I just, for no reason, it would just sort of come and go. And the classic advice is like, oh, you know, you just have to stretch like the foot and like just really focus on that area.
Right.
But how do you kind of more holistically, I guess, look at a situation like that?
Yeah. I mean, so I think, say, you know, someone's coming in for knee pain, right? So I'm going to do a full proper exam of the knee, but I'm also going to test the hip. I'm going to test the foot and ankle, right? I'm also going to look at mobility, range of motion, right? We talk about plantar fascia, and, you know, that fascia on the bottom of your foot is a continuation of the Achilles up into the calf musculature, right? And so when we have tight calves and tight hamstrings, that's a whole continuum that is then going to translate into the bottom of that foot. And obviously, once we start having issues, then all these compensatory mechanisms come about. And so when I see people, oftentimes the pain will start somewhere, and then within a few weeks or a month, they're like, well, now this is hurting too, and this is hurting too, because we subconsciously change the way that we move when something is hurting us, right? And so, you know, sometimes people with plantar fascia, it hurts walking in a certain way. And so they actually change the way that they walk. And that is now affecting everything up the chain because they're walking in a different pattern that they're not used to. And that's gonna put added stress on different parts of the body that weren't necessarily having that stress before. And so you see kind of all these compensatory mechanisms come about as one area is injured and then the whole chain gets affected, right? And so we want to make sure that we're looking at, you know, the joint above, the joint below, but also how you're moving, how you're walking. Pretty much every single person that walks in through the door, I check their core strength, I check their glute strength, because when those are weak, and I would say the vast majority of patients, those are weak, then you don't have that core stabilization that is protecting like your entire body. And so that, you know, and like athletes, non-athletes, you know, people who are just weekend warriors, everybody, if that area is not stable, then I know that there's going to be other areas of weakness that are going to be more prone to injury. So those are like things that I check on everyone. And obviously, like, it kind of all comes back to the core and the glutes, which is one of the reasons I named my practice Core, because it all starts with the core. So we need a solid core strength to really have a strong body and perform well.
Yeah. Wow. I hear that. You know, I've started working with this virtual trainer once a week. He's in India, and because I'm really into obstacle course racing. That's like the last 6-7 years.
Super fun.
And really to do better at it and to do better on the obstacles and all this mobility and core strength, like, you know, grip strength, mobility.
Grip strength too.
Yeah, grip strength, mobility, core strength. So this guy, he does obstacle course races. He does animal movements. And so that's what he's been like, these workouts on Fridays. I just did it actually a little this morning. So they're hard. It's really hard. I'm realizing, you know, and he has me do different plank variations and plank holds. And I'm realizing how beneficial that strength is, but also how you can be so unaware of it if you're not
100%.
If you're not using those muscles.
Even if you are though, and like say you're like doing a workout program and like you're doing tons of planks and side planks, if you aren't doing them with proper form and you're not actually engaging those muscles, you're not going to get the benefit. So like I'll have people come in all the time and be like, you know, I do these all the time. And then I test them in the office and I make sure they're in proper form. And then it's way harder for them. And I'm like, you have to make sure if you're going to be doing stuff, take advantage of that, but make sure you're doing it with proper form to actually get the benefit.
Yeah. And then you actually, when you're doing improper form, you might actually be harming yourself, like putting undue stress on your lower back or your areas that shouldn't be doing the work of stabilizing your trunk and things like that.
Right.
Yeah. Interesting. Okay. So do you have them work with like a physical therapist or a trainer, or how's your like treatment plan for a patient like that?
Yeah. So, I mean, everyone's obviously a little bit different. Depends on the issue, depends on the acuity of the issue. But I use physical therapists, I use trainers really all the time, kind of depending on what I'm looking for. For somebody who comes in who is looking to kind of optimize their health and wellness, you know, get stronger, doesn't necessarily have an injury, but they're just like, listen, I need to start doing something a little bit differently. I'm noticing that I'm, you know, not as strong. I want to be stronger. That kind of person, I will refer to a personal trainer who I, you know, trust a lot to get them going on a plan, watch their form, and just build their strength based on their goals. For somebody who's coming in with an injury, it depends on acute versus chronic and whatnot, depends on how else I'm treating them, but usually physical therapy will be part of that equation to help with the kind of recovery and rehab process, making sure that, you know, we are treating them with all the modalities possible. So I use those two a lot in my practice, and you know, it's really helpful to have people that I trust kind of in my region to make sure that I know that my patients are going to continue to improve and rehab well and get back to doing what they love.
I mean, that's probably such an important piece of it, right? Is having a good plan for loading. And
yes.
Yeah. And my understanding is that like loading safely and early is probably more beneficial. Is that right?
Yes, it is. You know, we talk about rest and recovery and whatnot, and recovery is super helpful. I think when people are injured, they're sometimes like, well, I'm just going to not do anything for, you know, a few weeks, which is often not the best thing unless you have like fractured a bone and you like really need the bone to heal. But otherwise, continue to stay active and load the tendon or the muscle properly is really important to kind of continue to get back and start that healing process. And that is where PTs can be so helpful in knowing kind of that proper loading phase, especially for my patients who have stress injuries or stress fractures from running. A lot of those, I love sending to a PT that I really trust to make sure that they are rehabbing properly, loading in an appropriate manner, not doing too much too quickly, and then doing sort of like a return to run program in addition to kind of the strength training as well.
Yeah. So for most injuries, is there sort of a kind of template that you're using, like in terms of a lifestyle plan? Like, are you sort of telling people to target certain type of diet changes or sleep target, or how are you incorporating, I guess, the rest of lifestyle in?
Yeah, I mean, I think it depends on the patient and where their weakness is, right? If it seems like they are really stressed, they have a busy job, they're, you know, a mom of 3, just have a lot of stuff going on, they're not sleeping well, then I'll usually do some sort of like stress management or like, again, sleep targets, but also talking about nutrition but again, not giving too many things to work on, because I think that's where the issues come about when like patients just stop doing well, is because if you throw too much at them, it's just not sustainable. And so setting these really small goals, right? In lifestyle medicine, we talk about these SMART goals, and having them be so specific for the patient, something that they can easily achieve, realistic for them, giving them, you know, an exact time, date, setting up a plan for them, whether that's, you know, nutrition targets, talking about, you know, more protein, right? Or adding more fruits and veggies, adding more whole grains. It's so specific to the patient based on kind of what their life looks like, but it will be usually incorporating one of those things also to help the healing process.
Yeah. But you're intentional about, I mean, I think that's really cool, like that you exist. I
Appreciate that.
I mean that maybe there is a community of sports medicine doctors that are lifestyle medicine certified. Are you in contact with other people in your?
There's not, I mean, I don't know of many. I know there's like a lot of kind of direct specialty care people that are in other specialties. There's some like, PM&R physicians, but I feel like I either talk to the people that are just sports medicine or just lifestyle, and then I kind of combine both of them. I combine the two, but I feel like with what I do, it's just such a seamless integration, and I feel like all parts of it apply to sports medicine, which is so cool, which is why I'm so excited about what I do.
Right. It's almost like a natural fit. Actually,
yes.
My vision for the future is that one would be able to, every doctor you see in every specialty would have a foundation of lifestyle medicine training and actually as part of their would be part of their practice too.
That would be the dream, and I think we would all be a lot healthier.
Then we'd all be a lot healthier. You mentioned the weekend warrior just briefly, but can you talk for our listeners, like how do you define that, and how do you train around, or how do you counsel kind of people who are training in that way?
Yeah, weekend warrior is an interesting term because I think what it like technically refers to is the person who's got a job during the weekend. Like, I honestly could be making this up, but in my head, this is kind of what I think when I hear weekend warrior. But someone who's really busy during the week,
Right.
busy with their job, busy with life, everything else going on, has a little bit more time on the weekend, goes hard on the weekend, working out Saturday, Sunday, doing whatever they're doing, and then like restarts the week. I would say I see more of like the intense recreational athlete. So I see a lot of people who go to these kind of boutique gyms around, which is a lot around me. And I actually teach a gym class at one of them. But I see a lot of them, and these people are actually just taking these like really high intensity classes multiple times a week, probably anywhere from 3 to 6 times a week. I would say that's more of the athlete that I'm commonly seeing, but they're not an elite pro athlete, they're not a college athlete, but they're kind of at the same age of probably what you think of as a weekend warrior, but still really busy, but they prioritize movement in their life. And also the place that they exercise is their community, right? And that brings in the social connection piece, which is so integral, right? And when you go into these communities, and the gym that I teach at, I feel like I've really become part of this other family and community that you go there and you're just so excited to be around these people and all doing something that you love. You're moving together, you're having a good time, and it's just awesome. Like it's so exciting. It's so fun to teach them. It's so fun to take the classes. But I would say that's more of the common patient that I see, but they still experience injuries, right? And they're kind of also at the age where the injury might just be nagging for a while, right? It might be shoulder pain that comes and goes every once in a while. And if they do too many shoulder presses, it, starts bothering them. They have it hurts for a little bit and then it goes away. Or they develop the plantar fascia, they develop the Achilles issues. So it's more of these sort of chronic overuse issues that I see. That I love treating those too, and sort of, again, seeing how I can get these people continuing to stay active, whether that is through treatments that I do, whether that's, PRP, shockwave, things like that to stimulate healing and sort of stimulate the inflammatory process, but also keep them moving, keep them active and not taking that part away from their life.
Oh, yeah. Did you probably are talking to them and seeing what they're most important to them in terms of what they value and like what activities they want to get? Because like I imagine if certain movements are aggravating pain, you want to get at the root cause and maybe the movement pattern, but also if it's like a movement that they don't necessarily need to be doing because it's not necessarily something that will benefit them, it's just causing pain. Yeah, I don't know. I think sometimes
then don't do it.
Yeah.
Yeah. I actually have that discussion a lot with people who are in my class, and I'm always like, if something hurts, like please raise your hand so I can come over and I can give you modifications. Like if, an overhead press with a kettlebell is hurting you, I don't want you doing that, right? So like I will find a way that you can continue to do stuff. And luckily they're all, very down with that. But
You do kettlebell training with your classes?
I do. The gym that I teach at is it's in an old auto shop. And so it's got all the other machines. It's got, a skier, a rower, picture kind of your CrossFit type gym.
Yeah.
But it's also kind of just a big open space, and there's usually a lot of people packed in there. And so the most that we use is usually kettlebells. So I do a lot of kettlebells.
Oh, that's cool. Yeah. No, I mean that class I just did, or that trainer session I had, we also do work with kettlebells. And I started getting more into that. I mean, the gym I used to go to, which is, speaking of, like, when you were saying that, I was thinking about this gym I used to go to, which I went to for quite some time, like 5-6 years, and how much community I had there. And I would always joke, like, when I showed up, like, oh, I showed up to like hang out with people, and I almost forgot that I that I have to exercise.
Yeah, so you're getting an awesome workout in.
Yeah, right, exactly. So and now I do something. I don't know if you're familiar with F3.
Yes, a little bit.
Okay, yeah, it's like a men's group.
Okay.
There are men's groups all over the world, all over the country, but like they're just like peer-led workouts with men.
That's awesome.
Yeah. So I meet up with these guys, like on Thursdays we go for a run, and on Fridays we go for a hike. Actually, Saturdays we do like this boot camp style workout that we take turns. We call it a beat down. Anyway, that is such an important part of it for me, is the connection piece. I heard you say that. Yeah.
It's huge. And like, I feel like even teaching that class has totally filled my cup of being connected with this community that, like, I now hang out with them outside of the gym also. And I've just met some really good friends and awesome people. But I think we can't overlook that these classes are more than just exercise, right? And each gym that you go to, and I've gone to a lot of them because that's where I do a lot of my marketing, you find its own community, right? And there's such tight-knit communities, gym to gym. And I think that's something so special that can't be overlooked with these types of gyms.
Yeah, totally. Oh my God. Yes. I it's energetic, and goes beyond just the fitness piece. Like, it's so good for your mental health. And to your point, I have made, sometimes people think when they get to a certain age, oh, I'm in my 30s now, I'm in my 40s now, I'm in my 50s now, like, I'm not going to make good friends. Like, and then but then being involved in these different fitness communities has totally made me realize that's so wrong. Like, you can meet people at any age, of any age. I have friends now who are much younger than me, much older than me, because of these fitness communities. And like, it's really people that I otherwise probably wouldn't have met. And you're spending time with them, like doing your class, like everyone's like, you feel so good when you're doing it. Like when you're doing it and afterwards, and then to be with other people, like you're almost like in that kind of euphoria, that high together. So it's really cool. Yeah.
It's really cool. And it's really cool to be a part of. And I think that's why like these types of communities are so important, not just for movement, but for the community itself. And I think, being a busy professional adult, right? It's also sometimes hard to like go out and meet friends, whether you're a new mom or whether you're just a parent or you're just working, a job. You're so exhausted during the day, right? And you have no interest in like trying to go out and meet people, but it's almost this just natural integration and social connection that you just don't even think about it. And then these people just become your friends, and you're like, this is awesome. And we love doing the same things. We're getting so much out of this that it's, it's amazing.
Yeah. And even things you don't love. Like, I don't really love running, but like now I go running every Thursday because I love running with my friends. And, and like the conversation makes it, and I enjoy running more than I enjoy running more than I used to because I'm doing it now regularly. And I'm doing it now regularly because I'm doing it with them. Yeah, totally.
Right.
Okay, I want to ask you about chronic pain, because at a certain point when pain lingers, beyond tissue healing, is there a change in your approach?
Yes, there is. So again, when I see someone, time frame is really important. Also, the mechanism of the injury and if the patient actually remembers an injury or if it's mostly an overuse thing. And so with tendons, we see a lot of overuse. And so depending on how long it's been going on for, it's either that acute, subacute, or chronic. And chronic is usually, anywhere after that 3 months time frame. And most people I see, it's been way longer than that. I've seen people who have had issues for 8 years, 10 years. And it definitely changes the approach because the tissue is different. And the healing process is much different, right? When you're still in that acute phase, your body's already in this natural inflammatory stage where it's starting to do its own healing and remodeling and, blood vessel formation and everything. Once you get to this chronic stage, you see differences on ultrasound. So I look on ultrasound a lot when I'm looking at tendons. When I see someone, you see thickening of the tendon, you can see these partial tears. So it overall looks different than, an acute injury where the tendon usually looks okay. There just might be a little inflammation. Once it starts getting chronic, you don't really see that inflammation anymore. And so you've entered this other phase of remodeling. And so you often need to actually do something to stimulate that healing. I try to start off as conservative as possible and, have somebody start to PT first if they're not doing that. If it's been going on for a while, people had usually tried a lot of stuff. If they haven't been to a good PT, I make sure that they get into a good PT who I know will get them better and load them appropriately. But they also may need something else in addition to that to help stimulate healing. And that's where, when I do certain procedures, the goal is to help to bring the healing, bring the inflammation response back to, again, let the body kind of start its own healing process. And so that's where things like PRP or platelet-rich plasma or shockwave therapy have been really, really great for tendons that have just been, going on for a very long time and nothing has been able to help it so far. It again helps to stimulate that healing process. And then that kind of combined with more physical therapy, the appropriate loading, that helps patients usually kind of get over that hump and start having some improvement in their symptoms.
Okay, I hear that. And so along the way, like the pain probably in those types of injuries is slow to improve. What does progress look like if pain isn't a perfect guide? Like what metrics do you watch?
You kind of can keep an eye on the ultrasound and see if there's any tissue healing that way. Pain is usually a pretty good predictor. Also, just functional status, right? And so a lot of times I have to really ask people, I'm like, so how do you feel, compared to last time? What differences do you notice? And it's usually very small in the beginning because these things just take a really long time to heal. But it'll be very little things like, oh, I didn't notice that, my foot was hurting as much when I first got out of bed in the morning or when I was, walking up and down stairs. It's just, I don't notice it as much. And then as time goes on, we're like, oh yeah, this is really getting a lot better. I feel like I'm not having as many limitations with the things that I'm doing, or it's not waking me up at night. So kind of getting an idea of how the impairment was presenting itself before and trying to compare that and have the patient really be in tune with how they feel and how it is affecting their day-to-day can be very helpful, because from a functional status point, it's like, oh, you weren't doing this before and now you can do this. That's really encouraging. And so, because a lot of times patients are discouraged with like, oh, my pain doesn't feel that different. And so then I dig a little deeper and I'm like, well, can you do this? And they're like, yeah. Or if I'm touching on exam and I'm, manipulating and they're like, yeah, that doesn't feel bad. I'm like, that's really impressive because it's progress. And I think also patients hearing that, they're like, oh, maybe this is working. And obviously now you have that component helping too. But just trying to, point out the little things that may be improving, I think is helpful, for patients, and making sure that they're very in tune with how they're feeling and how it's affecting them.
Yeah, it sounds like your patients get like very caring and thoughtful attention from you.
That's why I started my own practice, right? Is I finally get to spend that time with them and give them the time they deserve. And most importantly, listen, right? I think the vast majority of comments or reviews that I've had, the biggest thing that patients mention is I actually felt like I was listened to and supported in my care, which is unfortunately, I think, one of the detriments of the current healthcare system. And that's not the fault of the physicians. It's just the fault of the system. And we don't have the time to give patients. And when we don't have that time to give them, we can't establish a trusting relationship. And the more trust that you can establish in that relationship, the more you find out and the better you can help someone. And I think that is such a critical part of medicine and healthcare, is listening with empathy and really just getting to know our patients. And if we even hit that step, we are so ahead of the game, because our patients are like, oh, I actually have somebody on my side now, and I've never had a doctor who has called to check in on me or has spent an hour with me figuring out what's going on and making sure I'm aware of the game plan and making sure I'm on board with it and I have a say in my care, right? And I think all of those things, I mean, that's why I do what I do now, and it is so rewarding, and I feel so fortunate to be doing what I'm doing.
Yeah. I feel that from you. That's really cool. And it's probably like, what did you leave to do what you're doing now? Like, it's not always easy to take that leap, right?
Yes. I started off my career at a fellowship at a huge orthopedic group and was doing 100% sports medicine. My visits were quick. I was seeing a lot of patients per day, and honestly, it was a great way to start my career, being a new attending, having that support network around me, always having somebody else in the office to bounce ideas off of, or have someone help take a look at an X-ray or an MRI and, just kind of talk to in the office. I thought that was really important part and way to start my career. I then moved from that to a smaller practice, actually predominantly a physical therapy group, where I started the medical side of that practice. And it was very, approach with a lot of multidisciplinary approach. And that was very cool. I just wasn't the environment for me. And so I kind of was at a crossroads. Do I go back to the big ortho group, or do I just start my own practice and have the autonomy? I can make the decisions. I can treat patients the way I want. I have a little bit of flexibility over my schedule. I have 2 young kids, and that was important to me. And so all of that combined, I was like, all right, well, let's just figure this out.
Yeah, that's so cool. And so how old is your practice now?
It is 9 months.
9 months. Okay. It's still in the first year.
Still young.
Still young in the first year. And imagine you've just been learning so much in this experience.
Yes.
Like, what have been some of the big lessons, or what has been surprising for you about this whole experience?
Yeah. So it's really hard, obviously. And I think if you had asked me when I was in fellowship or residency, or even at my first job, if I was ever going to start my own practice, I would have been like, absolutely not. I have no interest in doing that and, taking that on. I have no business background. But, one thing led to another, and here I am. So I think the business part of it, the marketing part of it, also important. I think that's been really exciting to find out. Not necessarily the business part of it, because I don't love that part. But we're not, as physicians, I feel like we're not necessarily meant to be salespeople also. But the marketing piece has been honestly very fun, because I have just been able to get out in the community and meet so many incredible people that I would have, again, never met before, whether they're gym owners or physical therapists. And I feel like I am becoming so much part of this community, and it's so rewarding, and just feeling like I'm part of something more, and being able to be somebody in the community, not just someone who's like referring to a physical therapist, just because I love knowing the people that I'm referring to. I love having all these other resources and knowing these all like other small business people, around me. And that part has been super fun.
Awesome. Yeah. And that's like become, I don't want to say referral network, but like there's just a trusted people that you mentioned it earlier, like you can send someone and you have trust that you're putting them in good hands, that they're going to get better in the way that they should if they do what.
Yes.
Yeah. That's important. That's so important to have the right people that you trust, and that because your patients put a lot of trust in you.
Right. And it all comes back to you. And yes, And I want to make sure that where I'm studying them, they're going to get better. And I always valued, I had a lot of attendings in fellowship that I was always so impressed because when they were talking to patients, they'd be like, I want you to see this exact person at this physical therapy place. And I'm like, it's so cool that they can refer to a specific person because I feel like it gives the patient so much more comfort being like, okay, I know exactly who I need to see and my doctor really trusts this person. And so I have been trying to do that now. And this is the first job I feel like I've really been able to do that and know my referral sources and keep in touch with them and, send them updates after I see their patients or, shoot them a text saying, this is who I'm sending you. This is what's going on. And the fact that we can continue communicating with each other to keep each other in the loop is, I feel like what medicine should be, right? Is just you have a team that is there to support you and advocate for you rather than having, specialists here, specialists there. Nobody's talking to each other. Everyone's doing something different. And it's so hard for the patient.
Yeah, it's so disjointed for the patient and it makes no sense. And then so many of the things are happening because like so many specialty referrals happen in the fee-for-service system because of the just because then they'll do another referral. They'll see another patient. I don't know if it's done a lot of things aren't done necessarily in the best interest of the patient.
Right.
And you created an environment and a system and a practice setting really where you can align the interests of the patient with the practice that you're doing.
Yes.
That's what I'm hearing.
Which is awesome. And right, that's what I would want as a patient. That's what I would want for my family member, right? Is to have someone who's really on their team and who's going to look out for them and make sure they're getting the right care they need, whether that's with you, whether that's, someone you're referring them to. But I want to trust that person and make sure that the patient will do better with this.
Yeah. And so your care is what we call direct care, right? And direct specialty care, which I think people are more familiar with direct primary care, which has become, I think, more widely, understood, but also embraced because people get exactly this. They get longer time with their doctor. They get kind of more personalized care, but you're providing direct specialty care, which, and so that's a newer model of care. I get that. It's interesting though, because I know I work with people as well. I mean, that's kind of what I do too, to be honest, right? I provide direct specialty care as a lifestyle medicine doctor. And people, I charge like a membership model as well. But people are able to use their health savings account. And honestly, my patients who have insurance, we do all the labs and everything through their insurance, but also they have these really big copays, and really big deductibles. So a lot of the care that they access through that insurance is very expensive to begin with.
Yes.
And so I think that's the landscape that, sometimes we used to think, because tell me if you agree with this, people will ask me then, they're like, oh, you're a concierge doctor. And I say, that's not my intention, actually. My intention is to set a price point where it's financially viable for me as a business, but also more accessible to people to receive this type of care if it's going to be beneficial for them and add value for them. And so that's different, I think, than sort of concierge medicine. But is that something you have thought about or kind of describe to people?
Yeah. And people similarly will say to me oh, you're a concierge doctor. And also in my mind, usually I'm picturing concierge practices to also be providing primary care services. I don't actually do primary care services at this point. And so I really am just providing that specialty care. And I think when we think about direct primary care or, concierge models, it is, again, more of that membership type model. That's something that I will probably be incorporating and, aiming for in the future. But right now I'm actually just, these are the prices for what it is. And it's totally transparent. When a patient calls and wants to make an appointment, I'm like, this is how it works. This is what's going on. I'll give you the itemized invoice after you leave so you can submit that to your insurance. But direct, just meaning in its truest form, we are taking out that that third party, meaning insurance, to get things approved or whatnot. And so I don't ever submit you. So the way I tell patients is like, listen, you're going to pay at the time of visit and you can then submit to insurance. You will never get a surprise bill from me. You're not going to have a copay from me. You're never going to get a surprise bill from insurance, right? Because we don't communicate.
Yeah, right.
And you're paying me directly and I'm providing you with the care and the value. And that's what's so nice is that like I can provide that value because I don't have to go through insurance. I don't have to get things approved. If I want to do a procedure that I think is going to help them, we can do it that day, right? I don't have to be like, well, let's send this for authorization and like wait 5 weeks to get it back. And then, you're in pain this whole time. It's like, let's just expedite this process and let's just do this. And I found that so many people, while it absolutely is a barrier for some, and some people are like, I'm going to use my insurance benefits because I pay a lot for insurance. Others are like, listen, I haven't gotten help from the traditional model and I'm looking for something else. I want to get answers. That's when they sort of head my way and we figure it out together. And it's just, that's it. So yes, it is. I think it's a very cool model. Membership is in my goal. It's just not something I've totally figured out yet.
Yeah, no, I hear that. I mean, you've done so much and you're growing and it sounds like you're really doing it in a way that is beneficial for the patients, but also really works really well for you.
Yes. Yeah. And I think as I continue to grow, the goal is to expand, right? And just kind of continue providing this care, adding on other modalities, other disciplines. And, that's the dream, but starting slow, and just taking baby steps and continuing to do what I'm doing.
Okay. I want to ask you about your view on footwear. I don't know if you have like any expertise or opinion on this. It's just an interest of mine. I think I told you earlier, I used to get all this like knee pain and foot pain. And during the pandemic, I kind of did this deep dive and rabbit hole, whatever, on the internet. And I discovered minimalist shoes as like the savior, as like the panacea. And I started using them almost exclusively at that point. And then I have for like the last 4 or 5 years. It only until recently I was doing a lot of pavement running in minimalist shoes and I started getting, I think, pain in my arch from that. And so then I've done a little bit more deep dive and I've realized that like it's not as simple as this shoe good, this shoe bad.
Yes.
There's certain types of footwear that are necessary. Now when I run on pavement, like I wear a different type of shoe. Yeah.
Yeah.
Yeah. I don't know. Do you have any thoughts on that, on how you counsel people on footwear or your own views on footwear for what you do?
Yeah. I mean, I have my own views. I am by no means a footwear expert. I know that I've talked to a PT that I actually that I have been to a few times and talked to him specifically about footwear and, the drop of the shoe and, should I be aiming for that, that zero heel, the zero toe drop, whatnot. And he actually was like, no, like very few people really need that. Like we all need like a little bit of support. And that was actually fascinating to me. And he was kind of explaining that. And I was like, oh, okay. So like, I don't need to be getting these, I don't need to be forcing myself to wear a shoe that actually doesn't feel good for me. And some people, it feels great. I know a lot of runners that do run in those minimalist shoes. For me, it doesn't feel as good. I mean, I like personally need a little bit more support, but it also depends if I'm running versus lifting. Like if I'm lifting, I could either be barefoot or I could just be in, I wear Nobles when I lift because it's just a very flat bottom shoe. Whereas like, I think lifting in a sneaker it does not feel as normal for me. But running, I mean, I also just run and do my cross training in a very neutral shoe because that's what feels good for me. I think more importantly is kind of the wide toe box, the stability, making sure that your toes are room to move. That part is kind of more important for me and making sure that my foot feels good. I've had a lot of ankle injuries, so I need to make sure that I'm protecting that a little bit. But everyone is a little bit different. I know that those barefoot running shoes were definitely a hit. And certainly a lot of people still are running them, but I feel like when I talk to like my podiatrist friends or foot and ankle friends, those are not the shoes that they're recommending.
Well, that's true. I did go see, so I would tell you, I was getting all these like foot pain. I went to go see a podiatrist a couple times, and they started recommending shoes with even more like padding and more.
Yeah.
And that worked up until a point until I'm actually a big believer in minimalist shoe. Now I don't wear them all the time now. And for certain activity, like when I go pavement running, like I have a pair of Hokas, which Hokas have like a lot of, but I realized that no, I need that for when it's like repeated. When I go trail running, now I wear this other brand called Ultras, which have 0 drop, but they also have, they have support in the shoe. And when I walk and do other stuff, I wear minimalist shoes. So I've come to realize, but the minimalist shoes have really helped me because, and I think the idea is that there's all these little small muscles in the feet that most people, especially if you wear those kind of very entrenched, like almost like armor shoes, your feet aren't really moving around much. Right.
That's why I like lifting when I'm doing sort of like my heavier lifting days. Actually, this either being barefoot or being in a shoe again where I can feel that, because I actually feel like if I'm doing a heavy deadlift or like a heavy squat, I do like feeling that and like feeling where my big toe is, feeling how my foot is on the ground, right? And I feel like that helps my movement patterns as well. I also just kind of like, I feel like it's a good feeling. I don't know if it's just like, I don't know. I think it feels good.
Yeah. How do you, so I'm curious about your training and your self-care. Like, so it sounds like you lift and run, like how do you approach your own training?
Yeah. It's gone through like I would say a lot of different phases. I mean, I've worked out, my entire life. I grew up being, a multiple season athlete. And then obviously college, that became more, a runner in addition to the sports. And now I've got a lot more into kind of the lifting, the cross training. So I would say I do like heavier lifting days, probably 3 days a week-ish, maybe 4. And then I do some like higher intensity cardio plus maybe a little bit of like lifting stuff, probably, I don't know, 1 or 2 days a week. And then I try to incorporate running or biking at least 1 or 2 days. So I would say my biggest weakness is that I really used to hate taking days off at all, which I would say within the past year has been a big focus of mine, because I just know how important that recovery is and you just don't perform as well. And I sort of found that out the hard way, because I feel like I just got very burnt out at one point where I just like didn't feel like working out. I wasn't performing well. And I was like, all right, something's got to change. I was like, I need to rest more. Like my body is clearly telling me I need that recovery. And like, obviously I talk to patients about this stuff all the time. But it's also for many of us, right? Exercise is our stress relief. And like, that's the thing that I do as soon as I wake up in the morning. And if I'm not doing that, I feel like I just have not gotten in. But now I'm like, all right, on those rest days, like I'm just going to go for a walk in the morning. And like, that's sort of my, active recovery, but it's not a brisk walk. I'm walking, I'm enjoying being outside, and I actually really look forward to those rest days now, because I'm like, okay, I get to recover and I know that I'm going to come out stronger, the next day that I work out.
You're saying so many things that resonate with me about why we actually move. Like it's, you can talk about like all the health benefits and whatever, but like how it makes us feel good, how you feel in the morning when you do it. And even like the walk you're describing as an opportunity to reduce your stress, and help with active recovery. Because do you encounter this a lot? A lot of people come in and they're looking at exercise really as this like phenomenal chore. Like they're looking at it as like, right? How do you help them reframe that?
Yeah. So I kind of go back to the basics, and I'm like, I literally ask them, I'm like, what do you enjoy doing? Like, what do you like doing? Is that dancing? Is that bowling? Like, being active doesn't mean running 5 miles a day, right? For everyone, that's going to look so different, right? I don't love endurance runs anymore, so I don't do them anymore, but I still like going for shorter runs. I want to make sure I still can like maintain a very good 5K time, but somebody might just be like, listen, I love dancing. I'm like, great. Like, look at YouTube and look for like a 10-minute dance video or just dance in your kitchen, right? I want you to enjoy what you're doing because you won't do it otherwise, right? And that's such an important part of exercise, right? Is it needs to be not, I mean, sometimes it's not as fun if you're like doing something really hard, but like you need to enjoy it, right? And if it seems like a chore, you won't do it and you're not going to look forward to it. And so I try to like dig and find things that people, whether that's something they used to love doing, and usually every single person, if they're like, I don't know what I like doing anymore. And I'm like, well, let's talk about what you used to do. Let's talk about, what some of your hobbies are, what you might look forward to. And everyone can come up with something. And that could be walking, that could be swimming, that could be, again, like bowling, it could be whatever. And I think just finding that, people are like, well, is that really going to help? I'm like, it's a step in the right direction, right? And you enjoy doing it. So you're more likely to do it more. So finding whatever it is that people like and working with that, like, great, we can expand on that and make our goals relative to that rather than forcing you to do something that you don't want to do.
Yeah. Oh, totally. Okay. Are you familiar with Michelle Seeger? Do you know this woman?
No.
Michelle.
Why is it so familiar?
She's a researcher, author. She's a PhD at University of Michigan. And this is what she studies, like motivation and why people exercise. And it's she describes it as like the chore gift. Like people frame set and view it as a chore versus people who view it as a gift. And so like, how do you help people make that shift? Actually, I invited her on I saw her speak several years ago, and I was someone who looked at it as a chore my whole life.
Yeah.
And then it was like a light bulb moment for me. And then when I started this podcast, like probably like within a year, I was like, oh, I want to invite her. Like that's like the Health Feast, the name comes from this idea that good health doesn't have to feel like a punishment. It can feel like a feast. It can feel indulgent and joyful and communal and all the things we're talking about.
Yes.
And so I invited her on and we connected. And then we've been collaborating sort of like we're leading a workshop. Actually, I don't know if you're going to the ACLM conference this year.
I'm going to try to. I really would like to.
Okay. If you go and you're interested, although you already sounds like counsel this way, we're leading a workshop on this exact topic, like how to help clinicians counsel their patients on exercise in a way where they actually want to do it, like where it'll be sustainable for them. So, because that's her life's work. And then I've started like incorporating her protocols into my practice.
I feel like that's also like at the crux of lifestyle medicine though, is like finding what works for the patient and making those individualized goals, whether that's, nutrition, sleep, exercise, right? You're not going to tell someone to do something that they're not interested in doing at all. You need to find something that they are actually like, oh yeah, that sounds good. Or like, that sounds like something I can definitely do, or like something I want to do. And that's when you know that there's a higher chance of success.
That's right. It's almost, and it's like weird for them because most people have this, like they think of PE class, or they think of like, they have this like negative connotation, or they think of like
being forced to do something.
They think of like what I used to think of, which is like going to the big box gym, like around New Year's and standing in line for a treadmill.
Yes.
And then using, or an elliptical machine, and then like kind of like staring at CNN for 30 minutes.
Right. And like being on the elliptical for 90 minutes because that's like,
right.
what will give you the results, right? It doesn't have to be like this. We can change that narrative.
Okay. If our listeners wanted to do one simple experiment this week to feel better or to move better, what might you recommend, Dr. Weinstein?
I feel like you're probably a few. I mean, I would say one thing that I love, I actually posted this on my Instagram, I think like a few weeks ago, is when you first wake up in the morning to not look at your phone for the first 5 minutes and to instead either do some breathing, go outside, enjoy your cup of coffee for 5 minutes, move your body, or not 5 seconds, 5 minutes. Move your body, just do something that is good for you and that feels good for you without having, social media or the news be distracting you from the moment you wake up. Because I think that starting your day in control of what you're doing and getting that done before you have all these external factors that are bombarding you is so critical, which is why first thing in the morning, like I work out, I do my meditation, I do all of that before I look at my phone. So I won't look at my text, I won't look at social media. And to me, having that time to myself is, I know that anything after that will, help me conquer the day in a much better way than if I don't have that time for myself. So
I think
that's a really good goal for people to have.
Wow.
I think if you can move your body for 5 minutes a day, it's another good place to start. But I think it's just like very small goals like that.
Pick your favorite song to dance to every day. Yeah, that's a good one.
For sure. Music is so important. We could have a whole conversation about music.
Oh my God, yeah. I mean, I can't exercise alone without music.
No,
for sure.
Agreed.
I don't think it's possible for me.
Yes, I don't think so. It's definitely not possible for me.
Yeah. Okay, now I ask everyone this question. You are at our health feast, but you're coming to our proverbial health feast, and everyone's bringing their mindset tip or life philosophy. And what is Dr. Sassy Weinstein bringing to the health feast?
I would probably say that movement is medicine. And I think that however much we can move and anything counts, that is so good for us. And I think that telling that to people, and it doesn't have to be something structured, and it doesn't have to be for, 30 minutes at a time exactly. It's whatever time you can find to move, you will get benefit from that. So whether it's one of those small exercise snacks where you go up the flight of stairs and come back down between a patient, or, in the middle of the day, your lunch break, or just take one walk around the building, whatever you can do is helpful. And so I think telling people that, and whatever it is better than nothing. And they will reap the benefits from that in multiple areas of their life.
Love that. Okay. That's a good call to action for all of us, to move a little bit every day.
Move your body.
And to not look at our devices first thing in the morning. I think that's to reclaim that time for ourselves, to set the intention.
So important
for our day, and to really set ourselves up to be in control of the day. I love that. Oh, that's amazing. Okay, well, if listeners want to find out more about your practice, about you, where can they find you?
Yeah. So my website is choresportsmedicine.com. My Instagram, which is probably like where I'm most on, is at Dr. Sassy Weinstein. And my Facebook is just Core Sports Medicine and Lifestyle Medicine. So I do put out a 5-minute workout every Monday. So for people looking to start slow, it's body weight. I do kind of combinations, mobility, strength, upper body, lower body, full body. So always a good place to start. Just need 5 minutes. But I try to put out, some food content, some lifestyle content, and, local events.
Awesome. Yeah. Okay. Well, I gave you a follow already, but all our listeners will have to give you a follow. And really appreciate your time and your energy and your knowledge and everything you bring to the conversation today. Thank you so much.
Yeah. Thanks so much for having me on. This is great.
Okay, so we do our requisite fist bump to the camera. Boom. All right. Thank you, everyone, for listening. Until next time, live well and rock on, everybody.